So I'm going to be doing the nasogastric video and the sectioning as well. So before doing this procedure, I would make sure to have proper personal protective equipment, depending on the patient's contact precautions. But for now, I'm just going to say that obviously I would be in proper uniform attire, so have scrubs on, and I would also have my name tag as well to identify myself. First things first, I would make sure to have checked the order for if the patient did actually need an NG tube, so I just would have checked it. And so first things first, I would go ahead and knock on the door. So I would knock, announce myself. Hello, my name is Acacia. I'm going to be your nursing student for today. I'm just going to close this curtain, and that's just going to provide for privacy. And so first things first, I would go ahead and explain to the patient. So first I'm going to go ahead and identify you. First, I would make sure to have performed hand hygiene before actually performing any contact with the patient. So even before even coming into the room, so I would go ahead and perform hand hygiene. And I'd let that dry. And then I would go ahead and identify the patient. So I look for an ID bracelet. So here's the ID bracelet. So I would then ask the patient if he could identify himself. Sir, could you please identify yourself? Okay. Hernandez. Okay, great. And can you please state your date of birth? Okay. So once the patient has identified themselves by name and date of birth, then I would go ahead and just confirm that. Then I would ask the patient, sir, do you have any pain? Do you have any allergies? So if the patient did report any pain or allergies, I would make sure to document that as well. So now that I've asked the patient if they had any pain or allergies, then I would go ahead and raise up their bed. So first things first, I would go ahead and explain to the patient the procedure that I'm going to do. So sir, I'm just going to be doing an insertion of an NG tube, and I'm also going to be doing some sectioning. The NG tube is supposed to help relieve any nausea and the vomiting as well. Hopefully it'll help with that, and just make you feel better. So once I go ahead and explain the procedure to the patient, then I would go ahead and first things first, I would want to go ahead and inspect the abdomen, also auscultate as well, percuss, or not percuss, but palpate, sorry. So, sir, I'm just going to go ahead and lift your gown up and provide as much privacy as possible. So first things first, I'm going to go ahead and just inspect the abdomen by seeing if there's any skin tears, lesions, any swelling that I could see to the abdomen. So now that I've inspected, then I would go ahead and auscultate. I would have made sure to have at least auscultated for 5 minutes, listening between a minute in each bowel. And I want to look for any hypoactive or hyperactive bowel sounds. And I would have also asked the patient maybe if they felt any pain as I palpate. So I'm just going to go ahead and palpate very gently. Sir, do you have any pain? So if he doesn't report any pain, then I would go ahead and document that as well. So now that I've inspected and auscultated the abdomen, then I would go ahead and make sure to that my equipment is working well. So I might go ahead and just look at these wires to make sure everything's connected well, nothing is abnormal before doing my procedure. So now that I've inspected the equipment, then I would go ahead and start to do my procedure. So first things first, I want to go ahead and perform hand hygiene. And then I would first grab my tape. In this tape I'm going to use, a piece of it I'm going to use to tape the tube to the patient's nose, just to hold it in place. And I just want to get my tape out now so that way I'm ready for the procedure. Just put a piece there. And I'm going to get another piece of tape so that way I can measure at the end of the tape to see, like, once I measure the tubing. So once I've done that, then I would go ahead and put my gloves on. I'm going to go ahead and put that down. Put these other gloves on. And first things first, I'm just going to tape, I'm going to measure the patient for the tubing, just to see how long. Okay. So I want to measure from the ear to the tip of the nose, down to the xiphoid process. It's about right there. So 45. Okay. And then I would go ahead and first I would want to go ahead and take this, and I want to go ahead and hold the tube, and I'm going to lift the patient 30 to 45 degrees. That's good. So I just want to make sure the patient is able to be in a good position while doing this. So then I would go ahead and take my blue pad, and I would go ahead and put it over the patient. And then I would just explain to the patient that the blue pad is supposed to help with any fluid or just anything that might get his gown dirty, so it's just to protect him. And then first things first, then I would go ahead and make sure to get my emesis basin, and I would go ahead and have the patients. So sir, just go ahead and hold that. That's going to help you if you feel like you're going to vomit or if you feel like you might need to spit. So just keep that with you. And then I would also have the patient hold this cup of water with the straw. I would make sure that the wrapper's off, of course. And then I would make sure to have the patient hold this. And so this is just going to help you. You're going to start to swallow once you feel that gag reflex. But you'll do it once I instruct you to do so. So once I've done that, then I would go ahead and take my lube. Don't actually have any because we're not supposed to put any in the mannequins. So I'm just gonna verbalize that I would actually take some lubricant, and I'll just say that I would have a package. I would make sure to open it and lubricate it at least 1 to 2 inches, just to facilitate the tube once it goes down the patient's nasal. First things first. I would want to make sure to ask the patient to touch each nair and ask which nair it's easier for him to breathe out of. So let's just say he would say it's the right or the left. So I would go ahead, and I'm on the left side, and go ahead and do it on the left side. And so I would also document that as well. So sir, just go ahead and relax. I'm going to have you tilt your head back. So I would go ahead and have the patient tilt their head back. And then I would take this end of the tube. And then I would go ahead and insert it. Okay, relax. It's not actually going to go all the way in, so I'm just going to verbalize that once it's all the way in, and I would say to the patient, once they start to feel the gag reflex, then they would go ahead and start to swallow. And I would say swallow, 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 swallow until it's all the way in. And I would have them bring their head forward as they start to feel that gag reflex to help it finishing going into their stomach. So I'd have them move forward. So that's how far the news goes. I don't want to keep my hands off of it at all until I have my tape to tape it down. So I would have made sure to not have let it go at all, because it could move, and we don't want that to happen. So once it's taped down, then I can keep my hands. Then I can remove my hands from it, and then I would go ahead to make sure that the patient is comfortable, make sure that they're okay, and then I would go ahead and take my syringe, and I would make sure that obviously it would be in a package because we do want it to be clean, and so I would make sure to also have set out at least some paper towels, so once I take to look at the pH, I don't want to get anything dirty, the patient's room with any stomach contacts or anything, so I'm just going to have this here. And so once I've done that, then I would go ahead and take this tube and I would go ahead and unclamp it. I'm going to go ahead and hold on to that. And I would want to go ahead and take at least enough stomach contents so that way I could check the pH level. So once I've got enough, then I would make sure to clamp it back up again. And I could place that on the patient's bed. And so once I have my gastric contents, then I would go ahead and take a pH strip. So now that I have my pH strip, I would also look at the stomach contents to make sure that it's normal color, so usually straw color. Make sure that there's no blood. If there's any odor that I can smell, document any abnormalities. So I would go ahead and take my pH strip and I'd place it on there. And I'd just put just enough stomach contents just to check the pH. And you want it to be, it's between 0 to 4, so if it's less than 4, then that's usually normal. And so then I would go ahead and take this strip and throw it away, and I would make sure to document that. And then I would go ahead and uncap this, and I would make sure to put the stomach contacts back into the tubing. So just put in whatever remainder there is there. And then I would go ahead and put my syringe and just hold on to it. And I would put this back in there and clamp it back up. Once I've done that, if at any point my syringe is a little dirty, I would make sure to wipe off any contents with the other clean side of the blue pad, or just any paper towels or anything. And then once I've done that, then I'd go ahead and place that back on the patient's bed, and I would grab my saline solution. And I just want to make sure that it's not tampered with, it's not expired, and so I would want to go ahead and uncap it, place it on the patient's, and then I would grab about, ideally 20 to 30 milliliters of solution. We'll say I'll grab 30. So now that I have my solution, then I would go ahead and cap it again, and I would go ahead and slowly insert the solution. And this is just to irrigate any bacteria or anything that might be stuck, any residue. And I want it to run clean. And I would go ahead and cap it back up. And then once I'm done with that, then I would go ahead and irrigate the blue vent with air. So I'd want to go ahead and clean up again with dirty side of my blue pad. I would go ahead and clean it. And then I would go ahead and take 10 milliliters of air. It's about there. And then I would take this blue side and cap that side. And then I would make sure to insert with air. And that's just to help clear any suctioning or anything, so forth. And then once I've done that, then I would go ahead and put my syringe to the side, uncap this, and then I would use this. And then that's when the irrigation would start, or the suctioning would start to remove the stomach contents. And I would make sure to put this above the patient's bed or abdomen. I don't want to put it below the abdomen, that way, because then no suctioning will occur. So I would want to either safety pin this, or I could just make sure that it's just out of the patient's way and it allows the patient flexibility. And then I would want to go ahead and, once I'm done with that, intermittently turn this on. And I would do it about 100 milliliters. Just turn that on. And once I've done that, then I would go ahead and I would want to measure the tubing, to where it ends from the tip of the nose to where it ends right here. And I just want to go ahead and document that. That way, if another nurse comes in and it does move, then they would go ahead and be able to know if it did move, determining on how long it was. So once I've done that, ideally that wouldn't have happened. I'll just go ahead and cap that back up. And then I would go ahead and keep that up. So I would make sure that's out of the patient's way. And then I would go ahead and take off my gloves. And I would make sure to clean up my area, make sure that the patient's comfortable. And then I would go ahead and document any abnormalities. And then I would make sure to put this back up. Lower the patient's bed. And then I would ask the patient if they're comfortable, is there anything that they need. Make sure that the tubing is in a comfortable space for them. And I would make sure to keep it up above the abdomen, as I mentioned. And then I would exit the room. And then I would make sure to perform hand hygiene and exit the room. I want to make sure that I properly dispose of everything. And then, as again, perform hand hygiene and then exit the room.